Hello viewers, welcome to our Facebook live session. On this World Heart Day, we have with us our specialist, Dr. Rahul Gupta, consultant, interventional cardiologist at Apollo Hospitals, Navi, Mumbai. He comes with over 15 years of experience in the field of cardiology. Welcome to our Facebook live session.
Thank you.
Today we'll be discussing on new advancement in the treatment of heart care. The first question is, what is the new advancement in heart failure?
Yeah, so heart failure is one of the most progressive disease now. This is the number of heart failure patients are increasing by the day, and India being the diabetic capital, the hypertensive capital of the world, the heart failure patients are also increasing. When we say heart failure, it is basically the heart fails to perform its normal function, which is the contraction and relaxation, and there are multiple reasons for that. Now, there has been a lot of advances in last decade in treatment of heart failure. There have been newer therapies which have come up. So there are now medicines which can improve in heart function, which can alleviate a patient's symptoms. Similarly, there are certain devices which can improve the heart function. So those people who are eligible for those kind of devices, their heart pumping from very severe dysfunction can improve to almost normal. One of these procedures is called as cardiac resynchronization therapy, where we try to resynchronize both the chambers of the heart so that they start functioning normally. It is called as CRT. Then there is something called as AICD, which patients whose heart continue to be weak, these are the people who are at risk of sudden cardiac arrest, where the heart can suddenly stop and they need shock to revive the heart. So our device is implanted into just like a pacemaker below the collarbone, and it keeps a continuous surveillance about the heart activity, and if there is an abnormal heart activity which can lead to sudden cardiac arrest, it will terminate before it becomes lethal. And then finally, now we have ushered into an era of heart transplant, which has become now common in our country, and at Apollo also we have done a lot of heart transplants. So there are two kinds of heart transplant. One is from the person who is brain dead, where he is either because of the stroke or because of the road traffic accident, but the heart is functioning normally, and if the patient's family is willing, then this heart is harvested and it is transplanted to a person who has got a very weak heart. And then there is something called as artificial hearts, where the artificial hearts are available, which can be transplanted into a patient's heart and it can function on the battery. So these are some of the latest advances in the treatment of heart failure.
So doctor, are there any recent advances in the treatment of coronary artery disease?
Yeah, so coronary artery disease is again a very important area, because coronary artery disease in Indians are occurring at a much younger age as compared to the Western population. So if you look at a person who is a Westerner, he might develop a heart disease at 60, 70, but in Indians we are seeing as early as 40s and 30s where the person is developing a coronary artery disease. What we are seeing is that we are now getting more complex kind of disease. By complexity, I mean to say there are multiple blockages in multiple blood vessels. So there are three arteries, main arteries of the heart, and then they have sub-branches and branches and sub-branches. And there can be multiple blockages, diffuse disease, which we are finding it in Indians, and then there is more calcific kind of disease. So there are some advances which have made the treatment of coronary artery disease very simple and precise. So previously, multiple blockages, the only answer was a bypass surgery, but with the advancement of treatment, we can deal with these kind of disease very well through angioplasties. Like for example, we have a technology called as optical coherence tomography, which is also called as OCT, or intravascular imaging, which we call it as, and it comes as IVUS or OCT. These can actually go inside the coronary arteries, which are miniature, 2 mm, 3 mm, 4 mm, and we can get that camera inside. We can visualize the kind of block which a person is having. So whether it is a calcific block, fibrotic block, or it is a lipid-rich block, these are various characters. What is the length of the block? What is the size of the vessel? And it helps to plan everything in advance very well, and we can choose the correct sizes of stents. Now, when we choose a correct size of stent and we look at the technical success after doing the angioplasty, we can do the camera again and we can see whether we have done technically good. These are the patients who really do well on long term if these advanced technologies have been used. Similarly, for breaking the calcium, we have now a technology called as intravascular lithotripsy. Now, this is the recent advance where a person is having a blob of calcium into the coronary arteries. Now, these are very difficult to crack and put a stent. You have to break the calcium, and sometimes it is so hard that it is where the normal balloons and all cannot break them. So we have this intravascular lithotripsy where we take a balloon into the arteries, and the balloon is able to emit the sound waves, and these sound waves are capable of cracking the calcium, and after which a stenting can be done easily. So very calcific arteries, multivessel disease, location of the blockages in very critical juncture, which were previously impossible through angioplasty, are now easily and precisely done with the use of these advanced technologies. Similarly, sometimes we are in doubt whether this blockage, does it need angioplasty, does it need a bypass surgery, does it need medical management alone. We can use an advanced technology called as fractional flow reserve, or which is called as an FFR, where we pass a pressure wire across the block and we measure a pressure difference before and after the block, and if the pressure difference is significant, then only these patients benefit by doing an angioplasty or a bypass. So sometimes a person who comes for a bypass surgery just ends up with a single stent, or somebody who comes for an angioplasty may just not need any treatment. So this is how these advanced technologies help us to treat the patient very well. Similarly, there are medical therapy has also advanced, and many of the cases with severe blockages can be managed with a optimal medical therapy, which are called as guideline directed medical therapies, especially in patients who are stable. So this is all about the latest in terms of treatment of coronary artery disease.
So what are the latest treatment in heart valve disease?
Yeah, so this is again a very good question, and the valve problem, as we all know, increases with age. It can occur at a younger age also when there is a rheumatic heart disease. So what are valves is first important to understand. So there are 4 chambers in the heart, and the chambers are connected between each other as well as between the tube through valves. So valves allow only unidirectional blood flow. So the blood flow will go only in one direction, and it prevents the backflow of the blood. But when the valves get diseased, either they are not able to open up fully or they are not able to close, causing either obstruction to the forward flow or leakage back, then this is called as valve disease. And when they become severe, a person becomes symptomatic and he needs treatment. Now, previously, when the valve used to become severely damaged, the only treatment to replace the valve was through open heart surgery. Whenever it required a replacement, it was only through open heart surgery. Now, with the advances in the treatment of valve disease, we can actually replace the valve or repair the valve even without surgery. So you can just go through the leg artery or arteries of the hand, arteries of the neck, and you can reach the heart, and you can take the valve which is folded inside a catheter, and you can take it to that area and then open it up. Now, one such procedure is called as TAVI or TAVR. Now, they are interchangeable word, which means transcatheter aortic valve implantation or replacement. We can replace the valve very well, very easily. The procedure gets completed in 45 minutes. The patient may be on the cath table for 2 hours, but we can complete this procedure in 45 minutes, and we can do it in complete consciousness. Only mild sedation is given to the patient. You can talk to the patient and you can complete this procedure. So I think this is one of the most heartening therapy, because we have done a large number of patients who were really sick, who could not undergo a surgery because they were having multiple issues like lung problem, kidney problems, and these patients were very symptomatic in terms of breathlessness, angina, heart failure symptoms, and they could be treated with this valve therapy, TAVI, and they become completely alright. So we use TAVI in aortic valve disease. Similarly, there is a mitral valve disease where if there is a severe leakage, we can use a mitral clip to prevent that. The leakage means the valve is not closing. So you can put a clip which will prevent it, which will cause a good closing of the valve and prevent the leakage. And this is also a latest therapy. Similarly, 2 other valves like tricuspid valve and the pulmonary valve. So there are 4 valves. First, I talked about the aortic valve, which is TAVI. Then mitral clip is for the mitral valve. And similarly, we have valves available for the tricuspid and pulmonary valves, which can be implanted without open heart surgery. So I think it is a great advancement in the field of cardiovascular sciences where valve can be treated very well.
So doctor, can you explain what is minimal invasive heart surgery?
Okay, so suppose a person has got a complete multiple blockages and he's a candidate for a bypass surgery. So bypass surgery can be done in two ways. You can open up the heart completely and then you can perform the surgery either on a beating heart or on the heart on the pump, where you stop the heart and is on the bypass, and then you perform the surgery. Now with the minimally invasive surgery, just through keyhole, as we do a laparoscopic surgeries, where through small holes you can actually reach the heart and you can do a bypass surgery, and patient can actually get discharged on 5th day as if nothing major has happened. So this is something which has come up very well. Even the valves can be replaced through minimally invasive procedures where only a small holes are made, not the entire chest is open, and we can do it. So there are certain very nice stories when these are the patients who came to us in Apollo, and where we were able to give them these kind of therapies and they did really well because they were fit for this kind of minimally invasive procedure. So it's not that every person can undergo a minimally invasive procedures. There are certain criteria which needs to be fulfilled. So our team of experts, so we have a heart team where we discuss all these cases, whether this patient will do well with minimally invasive surgery. If we fits into that criteria, then minimally invasive surgery is something which we offer. Of course, if not everybody can fit into a minimally invasive program, then we have to go for the open heart surgery. But that is also managed very well these days without any issues.
Is there any new advancement treatment for high blood pressure?
Yeah, so high blood pressure is a very common occurrence now these days. We are getting patients with very high blood pressure at a younger age also. And what we have started finding is that now many patients require multiple medications and still the BP is not controlled. So there is a latest therapy which has come up and which will be launched soon into our country, which is already being used in the Western world. It's called as renal denervation therapy. And just to tell you that I was amongst the first group of doctors to get training for this renal denervation therapy. It's a very simple procedure whereby through a small puncture in the vein, the artery in the groin, you can reach the kidney arteries. And you can give a radio frequency. It's a laser kind of thing. You can say it's a radio frequency which you give in those areas. And this procedure is called as renal denervation therapy, and it is shown to decrease the blood pressure significantly. So those people who are uncontrolled with multiple medications, they can get controlled with those medications. The doses of their medications can go down significantly, and over a period of years, the effect keeps on increasing. So this is one new thing which will be soon available for all the people who have got uncontrolled high blood pressure despite multiple medications.
Would you like to give a small message to our viewers on this World Heart Day?
Yeah, so my most important message on this World Heart Day is that heart disease is increasing, but it is completely preventable if we follow certain good things. Like for example, the 6E which I have been always telling people. The first E is that you exercise daily and you do all kinds of exercise like cardiovascular, which includes swimming, cycling, jogging, running, walking, anything which increases the heartbeat. Toning, which means use of weights, you tone your muscles. And stretching means like yoga, where you do twist and turns of your joints. Second E is your eating habits. So you should eat all healthy stuff. We all know what is healthy and junk. But we should also eat, timely, and we should eat with a peaceful mind, because when we eat with peaceful mind and relish the food, the digestive enzymes are secreted well and the absorption of the nutrients is better. The third E is that we should exit addictions like tobacco, smoking, excess alcohol. All these are killers and they can damage the cardiovascular system. Fourth E is your emotions. So your emotional health has to be good. So you should be happy, optimistic and positive, and you should do everything to make you happy, optimistic and positive. Reading good books, following your hobbies, doing meditation, taking deep breaths. It clears your mind. It helps your mind to become more focused and more active. Then your fifth E is your enough good quantity sleep. So you have to sleep enough, about 6 to 8 hours, because it's very important for the cardiovascular health. And good quality of sleep means that when you wake up in the morning, you should feel fresh. If you're not feeling fresh even after sleeping for 6 to 8 hours, and if you're snoring, you must see a sleep specialist to do a sleep study to understand what is happening. The sixth E is evaluating your numbers regularly. Now, these numbers are your cholesterol number, blood pressure number, sugar number, your weight number, your waistline number, because all these numbers tell us whether we are in appropriate health or not. If these numbers are out of the ranges, that means you need to take care, because the symptoms are going to come very late, and we can't just keep waiting for the symptoms to occur, because it may be too late to actually reverse the disease. So look at these numbers regularly, because they are all silent killers. Symptoms are only in a handful of people. So the only way to find out is you check them, and then if there is any abnormality, you treat them. If you follow this 6E, you will have a healthy heart, and I wish you all the healthy heart for many, many years to come. Thank you very much.
Thank you, doctor, for joining this session.
Thank you.